Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 244,935 confirmed cases of COVID-19 in Canada and 78,705 cases in Ontario. Chatham-Kent has 417 cases and Sarnia-Lambton has reported 374 cases. Michigan now has 178,180 cases, with 15,875 cases being in Detroit. Today, we are reporting 3 new cases of COVID-19 in Windsor and Essex County. 1 person is a resident in a long-term care home, 1 is a contact of a confirmed case, and 1 person is still being investigated. We have had 2,872 cases since March. 2,733 cases are now resolved, and 63 cases are active and being followed by our health unit. 2 people are currently in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are currently 2 long-term care and retirement homes experiencing a COVID outbreak. There are no workplace or school outbreaks. We have issued 2 charges to date, both related to the operator or staff not wearing masks after multiple verbal and written warnings. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit the number of your contacts. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing is available by appointment at selected pharmacies and assessment centres. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 assessment and testing centres, Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To provide an update on the flu vaccine in Windsor-Essex County, we have distributed 60,000 doses of influenza to 200 of our healthcare partners. All long-term care and retirement homes received their vaccine last month for both staff and residents. This year, we have over 100 pharmacies participating in the flu campaign, and to date, they have delivered approximately 27,000 shots. Yesterday, we announced our first case of influenza. However, we have since learned that this was a false positive and not a case of the flu. This has been confirmed with the lab, and as such, we will be rescinding the flu outbreak status at this facility. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. With more than 47 million cases globally and continuing to grow at a rapid rate, and with more than 1.2 million deaths worldwide, the pandemic is far from over. The COVID-19 pandemic has resulted in significant health impact and also created societal and economic disruption that this world has not seen before. Every country is following a different trajectory based on the measures that are put in place to prevent the health impact, including mental health impacts, societal and economic impacts. Leadership around the world across the region is dealing with a novel infection with very limited tool to fight this pandemic. As individuals, we are also struggling with this pandemic by making significant changes in our personal and social life, whether it's working from home, whether it's about doing your own self-monitoring, going to your grocery stores wearing a mask, washing your hands frequently, avoiding unnecessary visits to any retail stores, visiting your friends and family, etc. We all have lost many things in our lives to fight COVID, and in Windsor-Essex, we fought that battle really hard. We faced the enemy that is COVID with the case rates that were higher than the bigger cities of Ontario, but we all came through. We managed the long-term care home outbreaks. We managed the agricultural farm outbreaks. We managed community clusters. We reduced our daily case counts in a single digit now, and we are in a much better position compared to many other regions in the province of Ontario. There is no doubt in my mind, and I'm sure in anyone's mind, it was not easy, and it will not be easy moving forward. We have the power to control our fate and accept the reality that COVID is here in our community, and in the absence of any approved treatment or in the absence of a good vaccine to protect from this virus, we can only fight this virus with the tool that we have, that is physical distancing, wearing the mask, frequent hand washing, self-monitoring, testing, isolating, and preventing the spread of the disease. There are many similarities and many dissimilarities between the Spanish flu pandemic that this world has seen almost a century ago versus the COVID-19 pandemic that we are seeing right now. We are living in a digital era where everything is linked to virtually everything, and everyone is virtually linked to each other through the mobile phones in their pockets. While it was easy for this digital world to adapt quickly to COVID-19 restrictions, such as working from home, virtual meetings, online shoppings, etc., it also led to the widespread misinformation that created unique challenges for the public health world. Because of strict physical distancing measures, majority of us are relying heavily on the internet to get our news, connect socially with other people using global digital social networks such as Facebook or Twitter to facilitate human interaction and information sharing about the virus. This widespread sharing of information has blurred the distinction between good, credible information and misinformation. This free flow of misinformation on social media has undermined the effective response to COVID-19 by creating doubts in people's mind in many countries, including Canada and even locally. Some of the misinformation is propagated intentionally to serve a political agenda, whereas some of the misinformation is shared by people with good intention because for some reason they think that it's true, and by sharing this information, they are trying to spread a good message. Like many branches of medicine, public health is a highly specialized branch of medicine that specializes in the health of the population. You can say that public health is the science and art of promoting health, preventing disease, prolonging life, and improving quality of life through the organized efforts of our society. With the unchecked flow of information, it is becoming a challenge for public health officials to deliver the right information and get voluntary compliance from everyone. If you are on social media, you may have come across with the same message that is repeatedly shared. The idea behind sharing the same message repeatedly on every forum through misinformation at every news outlet everywhere by same people is to create that doubt, that mistrust in people's mind to promote a particular agenda. These messages are crafted deliberately to challenge science with personal opinions, and we should not fall into that trap. Personal opinion from lay people or even from experts in other fields cannot substitute information from credible science and experts of the field who has spent a significant amount of time getting their training, education, and experience in that particular field. Always follow the science, even when science cannot answer the question that you're trying to answer. But the people of science will tell you that they do not know. And yes, when it comes to COVID, we do not know a lot, but we know enough how to prevent the transmission of the disease. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, Doctor. Good morning, Teresa. First, I'll start with Teresa. I believe last week you reported that the health unit had received 95,000 doses of the flu vaccine, and now you say you've distributed 60,000 to local healthcare providers. Did I get the numbers wrong, or can you reconcile that for me?
So we have received over 95,000 doses. We get regular doses from the government pharmacy, but the distribution to our healthcare partners, we have distributed approximately 67,000 doses of that 95. So your numbers are correct. It's getting it from our health unit to the healthcare providers. So they each are allotted a certain amount. And as they use up their doses, they put in more orders to our health unit. And that's kind of how the process goes.
Okay, so a physician who runs out can put in an order and then they can receive more by going through that process.
Yeah, there is a process that we have in place with the primary care providers and others that are distributing the vaccine, other than the pharmacies who get it directly from Ontario government pharmacy. But there is a process, and we provide them as according to a schedule. But once they use up what they're allotted, they order more.
Okay, thank you. And Dr. Ahmed, you talked a lot about misinformation today. What's the biggest piece of misinformation out there that's really countering the messaging that you're trying to get across?
So one of the biggest things that what we are seeing is the resistance in terms of following some of those measures. If we compare what was happening with, if we want to call it our first wave, with the restrictions that were put in place, and there was obviously there was people who were not happy with those restrictions, but were following it. What we are seeing, even with some of these rallies, these protests and everything, it is much at a higher level, and which is could be something that is either intentional or unintentional, but it's undermining some of these messaging and some of this work that everyone is doing. We work really hard to get to where we are right now, and there's no doubt in my mind that our entire community has worked really hard to get to where we are right now. And some of these counter messaging, some of these messaging that is being put forward by various groups, I think it is damaging, and it would lead to a confusion and a chaos in the system, and nobody gets benefit from any kind of chaos and confusion other than the community, with unchecked infection increasing in our community, leading to more challenges everywhere. So we have to understand if the cases in the community increases, it will have an impact on our long-term care home system. If the cases in the community increases, it will have an impact in our school system. And the moment any of these high-risk, vulnerable population get worse, it'll be bad news for our community. So I really want to caution everyone in saying that we are still in a much better shape. Yes, we reported 22 cases recently, but let's hope that those are anomalies to what we normally see in our community, and we get back to where we were before with less than 5 cases every day, or even less. It was really a happy news for us to share the message that we had 0 cases to report. We hope that we get to that position in more days than we are seeing right now. So I wanted to get that message out there. That doesn't matter that if you're seeing the same message again and again, it is there intentionally. Some people are putting those messages intentionally out there to create those doubts and concerns in everyone's mind. Rest assured that the science and everything is catching up to everything that we know. We have always been transparent. What we know, we will tell you without any doubt that this is the issue. And if we cannot tell you, we will tell you we cannot answer that question. If we don't know the answer, we will also tell you. But instead of making up an answer or trying to create all those misinformation, we will never do that, and we will always also request you not to fall into those misinformation traps.
Thank you.
Any questions from AM 800?
I have a couple for Teresa and a couple for Dr. Ahmed. Teresa, just for the influenza, just want to make sure, so since it's a false positive, the release that was sent out yesterday, has that been rescinded now?
Yes, so we were in the process, but you're kind of hearing it firsthand. But yes, we have confirmed with the lab that it was a false positive, so not a true case of influenza. So we do not have any cases of influenza in our community, and we'll be rescinding the media release saying that it was a positive. And also the long-term care home where it occurred would not be considered in a flu outbreak.
Okay, thank you for that. And in regards to the second charge or fine that was laid, last time you told us it was convenience store. Can you let us know some of the details for this second one?
I did look at the name, and it looks like it's a small business.
In Windsor or the county?
Oh, I'm sorry, I didn't look at the address. I think it is Windsor, but I'm not sure. Sorry.
No problem. Dr. Ahmed, to you now. Yesterday, the province announced their, colors and risk meter were green for the province, but orange for locally. Do you think there's going to be confusion there? Has the health unit talked about maybe I know you put a lot of hard work into it, scrapping the local one and follow the province one. Any discussion there?
Yeah, it would have been much easier if if we know what's coming down the pipeline, and instead of spending our resources in developing that, that would be helpful. But in any case, obviously, we do not want any confusion in public's mind. There are different indicators that the province is using versus what we are using. And ours is much more elaborate. We factor in many other aspects of the pandemic measures based on our local experience. So we are looking at ways right now how to blend this all together so that you can still see what the province is looking for and get that information. And then we also want to keep some of those local indicators where we can provide additional details and additional assessment. So you will see some changes. We'll try to use what the province is using to inform us at this moment in our Friday summary, but we'll also keep our local one, and then by next week we'll come to a better position that how we can combine that together to create a better picture overall locally.
So as of now, for residents and I guess business owners, just follow both for the time being?
Well, I think it's the province hasn't technically officially started issuing that, but I would say for locally with our indicators, we didn't necessarily attach any specific restrictions or anything in place for that. So it's more of the indicator to tell you how are we doing as a region in Windsor-Essex. So the province, based on if you look at that, it will show you that we're in green, but then that will be updated as well. And then in green, obviously the province is also saying that there's no actions that's needed if you're in the green. And when we are saying that we are in orange, we are also saying that, yeah, no action is needed, but there are some recommendations that we are putting in place. There is no restriction that goes in with our indicator system, but obviously with the provincial indicator system, there are restrictions that could kick in if we move from green to yellow or to yellow to red. So there are different restrictions that will come in place. So we're looking at it to how to combine it together, but right now you're right. I would say that look at both, but we'll try to clean it up by next week to give you a better sense of how to interpret both. If you want to interpret how the province is doing, this is what it looks like, but along the sub-indicator categories, what does it mean and how are we doing in each of those categories?
Thank you.
I just wanted to add that I did confirm that both charges were in Windsor, and the second one is a small business related to food supply.
Thanks, Teresa.
Okay.
Any questions from CBC?
Yes, good morning. So we have these two outbreaks, one taking place at a long-term care home and another taking place at a retirement home. I just wanted to ask you, how concerned are you about these two outbreaks and the potential for the virus to spread in those places?
So obviously, when we are declaring an outbreak, there is a concern that the virus is spreading or could spread in that long-term care home or retirement home. There is a definition that we use, and some of those definition includes even one case. So if one case of a positive patient or positive staff while symptomatic working, it could mean that there is a potential for the disease to spread in that facility. What we do the moment we declare the outbreak, we immediately get in touch with the facility, put all those outbreak control measures in place. We do additional testing, we cohort people, and then make sure that we continue to do that on a regular basis to stay on top of anyone who's developing any symptom to contain it in the best possible way. So all those measures are in place right now, and I would say it's too early to comment whether it's getting worse or not. We're still in the initial phase, where we are investigating heavily to make sure that it's not spreading beyond those who are initially positive. So we are working closely with all our health system partners to contain it at this point, and there's nothing that's flagging to tell me that it could turn out to be a big outbreak. But we know that sometimes it takes some time for the infection to present itself after incubating the virus. So there may be some days of delay, but as of today, we don't think that there's anything concerning at this point other than to continue to enforce all those outbreak control measures and monitor them.
Great, thank you. And just a clarification question. So with the charge or charges, is that 2 additional charges since we heard about the convenience store a few weeks ago, or is this the second charge which includes that convenience store that we heard about before?
So it is the second charge, including the convenience store.
Okay, thank you so much.
Any questions from Blackburn?
Nope, all asked and answered. Thank you.
Okay. Any further questions from the Windsor Star?
No, thank you.
AM 800?
I have a question from my colleagues from CTV. Dr. Ahmed, they're wondering what are the rules for a teacher returning to the classroom if the cohort has been dismissed due to a student with COVID-19?
So when we are investigating any cases, so even when we're talking about investigation in an outbreak setting, whether we're talking about schools or other, our approach is to identify close contacts. And among those close contacts, we identify which ones are the high-risk close contacts and which ones are the low-risk close contact. And for all the high-risk close contacts, the recommendation is always to have them self-isolate for 14 days and go for testing if they develop any symptoms. For the low-risk contacts, we always ask them to self-monitor their symptoms. In situation when we are talking about any kind of school investigation, if the teachers, if they're following all those infection prevention and control measures, including wearing the mask, glass shields, and maintaining their physical distance at all time with all these precautions in place, they would probably be deemed as low risk compared to anyone else. So the low risk contacts can go back to work with all those things in place and including monitoring their symptoms. So without getting into the specifics, I can tell you that, those decisions are made based on the interview and getting all that information together. And then we made that determination whether it's low risk or a high risk. And then the rest is up to the school boards that how they are managing their staff based on that information.
Okay, thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
Thank you, everyone.
Yep.